The Trump administration, at the direction of Health and Human Services Secretary RFK Jr., has been chipping away at the country's immunization safety net with decisions over the last year that de-emphasized the importance of COVID-19 and hepatitis B vaccines, and earlier this year overhauled the childhood immunization schedule. And while these actions are being held up in the courts and insurance companies are continuing to cover the vaccines under attack, it's possible these immunizations could become harder to access in the future, which has prompted a response here in New York, with the governor and legislative leaders agreeing to adopt two bills addressing state insurance requirements, as well as decoupling state laws from federal vaccine recommendations. For more on the legislation, we're joined on the Capitol Press Room by State Health Commissioner James McDonald. Thanks for making the time, Doctor.
Hey, it's good to be with you again, Dave.
Glad to have you. So we can get to the potential impact of what's happening with the CDC's Advisory Committee on Immunization Practice under the direction of RFK Jr., but right now, with their actions held up in the courts, has there been any meaningful change to the status quo pre the Trump 2.0 term in the White House in terms of federal vaccine recommendations and how immunizations are covered by insurance?
Yeah, so right now the answer is no.
Okay.
And I think of it this way, like states are the one that determines requirements. The federal government makes recommendations. And when they make some of these changes, as they tried to do, it'll take a while before the payers are actually affected by it. When you get back to the vaccine question, though, what's kind of interesting is there's third-party payers, they like immunizations.
And that's insurance companies usually.
That's right. Insurance companies like immunizations for a reason, because they're cost effective. I mean, it's just simple, that straightforward. In other words, preventing disease is a good thing. So as much as there's been all this, I don't know how else to say it, but just federal strangeness with what's going on with immunizations. And Dave, it's troubling to me because when I think about emerging from a pandemic, we should have been embracing public health at the federal level, but they haven't really been. And, the Governor Hochul's been very supportive of everything I've wanted to do. And she's a champion of science and public health. And I really appreciate her support with the immunization work in particular. It's really been great to see her support and the legislature support on that too, by the way. I mean, there's a reason why New York State doesn't have a big measles outbreak right now. We have strong laws and we have a legislature that really partners with us on this.
Well, walk us through then the future that you're concerned about as the result of the Advisory Committee's actions on COVID-19, hepatitis B, and most recently, the childhood immunization schedule changes. What is it that you're worried about potentially happening moving forward?
Yeah, keep in mind, New York State had its law tied to the Advisory Committee on Immunization Practices, and not every state did that. States that were generally considered blue states did that. I'm not sure that was the best approach, but a lot of the red states don't tie themselves to the federal government on things anyways. But New York State had this, clause in there that tied itself where the schedule be determined by the Advisory Committee of Immunization Practices. In other words, that's how they'd decide, which were covered. This is the problem, and this is where this new legislation will help address this issue. Because what the new legislation does is bring the authority to decide if a vaccine is going to be mandated in New York, that's going to be the legislature and the governor. That's where that will be if it's going to be mandated. But once that is made, then the question is going to be like, well, who actually implements the regulations? Well, that's going to be the Commissioner of Health. And the Commissioner of Health will look at national bodies, national experts like the American Academy of Pediatrics, American College of Obstetrics and Gynecology, other national voices to help make these recommendations make sense into regulations here. And this gets back to the issue. It's the states that require, it's the federal government that makes recommendations. And then the payment questions will be straightforward. Because the Department of Financial Services, which really requires insurance companies to do what they're going to do, has been a great partner of ours as well. I mean, they know where we want to land on all this.
Well, let's talk about the role that you're going to potentially play in terms of recommending vaccinations moving forward with consultation of medical experts as we disconnect sort of the standards put out by federal health officials from New York's children's immunization requirements. What is the process that you envision playing out here? Is this something where you're going to convene, say, a formal advisory body in the future? Is this going to be you calling up somebody at the American Academy of Pediatrics? What does the process look like that you envision, assuming this becomes law?
Yeah, so keep in mind, right now the immunization schedule is not broken. It's actually an evidence-based schedule that makes a lot of sense. But national bodies put out recommendations. Keep in mind, the American Academy of Pediatrics has been putting out recommendations for immunizations long before the Advisory Committee on Immunization Practices. So it won't be like I won't need to convene and have a body of people. Those recommendations exist. Now, if you're asking, can I get on the phone with the American Academy of Pediatrics? I can, but I don't really need to. And the same with other national entities. In other words, vaccine recommendations from national bodies, they come out there, but it's not like you have to get them together and say, well, should we still require the measles, mumps, and rubella vaccine? We all know where the position on that is. And really what we're addressing with this issue is taking away the federal strangeness from what's been going on with immunizations and putting it back where it always should have belonged, which is in the state, where we just follow the science on this stuff. And I think we know immunizations are the best protection for vaccine-preventable diseases. We just know they are. And keep in mind, Dave, it was February 19th, the department celebrated 125 years of existence. I just think you'd find this interesting because I know you're a student of history. For the first 40 years, the commissioners of health were focusing on preventing things like diphtheria and polio. Remember, 1 in 5 children used to die of diphtheria. 1 in 10 kids died from polio. Like, they didn't have the tools I have. We have great tools right now. We have great vaccines. And, I've been a pediatrician almost 36 years now. Safest vaccines we've ever had.
Well, before we move on, let me reintroduce you. For listeners just joining us, I'm David Lombardo, and you're listening to WCNY's The Capitol Press Room, and we're speaking with State Health Commissioner James McDonald. Moving forward, it's one thing to say, okay, there are a whole host of vaccines that we have a history with, and we want to ensure that people, especially kids, are able to access them in the future. What happens, though, as new vaccines are developed and they're pitched for kids and might be covered by the children's immunizations requirements? What's the process then if you don't feel like you can turn to the federal experts for this guidance?
Yeah, so keep in mind, if any new vaccine gets created, it's going to have to be approved by the Food and Drug Administration, right? And keep in mind, the most recent vaccines that just got approved by the Food and Drug Administration were the RSV vaccines. There's one for babies, one for people pregnant. None of those are required at this time, right? But if you want to get a vaccine required, the steps for that process has to have successful legislation, has to be signed by the governor. Where the Department of Health role is going to be is, what's the timing of when it needs to be given? In other words, what's the actual schedule? If you think about most childhood vaccines, they're given at very specific times for a very legitimate reason, and that's where we would come in. But when you look at what we're really protecting New Yorkers from is from the federal government doing what it tried to do, which is really upend every state's immunization schedule and really disentangle, quite frankly, prevention from science. I mean, one of the things I just go back to is, the little expression, ounce of prevention is worth a pound of cure? They just created a pound of confusion with all this stuff.
Coming back to the issue of those third payers, what the insurance companies will or will not cover, the legislation, the second bill up for consideration in Albany, would disconnect state law governing health insurance coverage for vaccines from federal guidelines and instead, again, base those on state recommendations that would be handed over to, as you mentioned, the State Department of Financial Services. Given the fact that there are so many New Yorkers, though, who rely on federally regulated insurance plans to cover services like immunizations, what do you see as the potential reach of this legislation? I mean, how many people are covered by those state-regulated plans that would be impacted by this?
So it's mostly children that we're going to talk about, and mostly in Medicaid that are covered. Keep in mind, there's 6.5 million people covered right now by Medicaid, and Department of Financial Services really regulates commercial insurance. But I think really this gets to insurance companies want to do the right thing here. And when we look at Medicaid, we contract with all those Medicaid managed care plans. I think the important thing to keep in remember, though, is if you look at where the courts in the United States have been on where the federal government's been going with all this, the U.S. District Court soundly rejected what they were doing. They basically said, you didn't appoint the committee in a way that makes sense. And I think it really gets to the point of they've pretty much undone everything this committee's done. That actually heartened me quite a bit because the courts saw this, and thank goodness we have people who are lawyers and judges who get this and fighting for public health. But I think what you're seeing right now is most of what the federal government is doing isn't really being accepted by the courts. They just can't willy-nilly do these things.
Is there a world, though, where you're maybe concerned about the federal government putting strings on Medicaid eligibility so that they say you can't make a Medicaid payout for one of these vaccines? And if that happens, is the state going to have to step in and say, okay, well, we'll foot the bill for that?
So I think you're getting on one of the root issues here that we need to be sensitive to. So like we have something called the Vaccine for Children's program, which is a federal program, and they pay for the vaccines, for children who are covered by these federal programs like Medicaid. And yeah, I'm concerned that the federal government might get hostile to the Vaccines for Children program. I'm hoping that doesn't happen. When you look at national polling on this issue, they're not heading in the mainstream direction here. I mean, where the Secretary of Health and Human Services headed is not where the country wants to go. And one thing that's interesting is they try to get us confused by talking about something called shared decision making. But just so you know, Dave, I've been a pediatrician for almost 36 years. Every vaccine I've ever gotten, and it's been so many I've given, it's over tens of thousands of vaccines. Every one of those vaccines gets informed consent. Shared decision making and informed consent are very much similar concept. You're still talking about risk and benefits to people. So when parents are choosing vaccines for the kids, of course there's a conversation of risk and benefit. And I think this is part of where they've just tried to be confusing and haven't been helpful.
But coming back to what you pointed out about the value of an ounce of prevention, if the federal government was to essentially stop paying for any sort of vaccines that kids now get paid for by the federal government, would the state have a vested interest in ponying up that initial cost?
I think we have to be careful not to speculate on what future could happen there. Obviously, vaccines are important. I don't see the federal government heading in that direction right now. But the question you're posing is, are vaccines cost effective? And of course, they're cost effective.
Well, we've been speaking with State Health Commissioner James McDonald. Commissioner McDonald, thank you so much for making the time. I really appreciate it.
Oh, my pleasure, Dave. I hope we talk again soon. Thank you so much.
Support for the Capitol Press Room is provided in part by the Lawsuit Reform Alliance of New York. Fraud and lawsuit abuse impact car insurance costs for New Yorkers. Reforms are being proposed to mitigate their impact. Information on these reforms is available at keepnewyorkaffordable.org.
Support for the Capitol Press Room comes from O'Donnell and Associates, a public affairs firm providing strategic guidance to businesses and nonprofits on navigating policy and regulatory issues. More information is available at o'donnellsolutions.com.